main experts in the gender medicine field from Charité Berlin, the European Institute of Women's Health, and the University of Maastricht established a European gender medicine network to develop a roadmap for the implementation of sex and gender in medicine. At the final conference in Brussels, over 80 experts were brought together to discuss how to best integrate sex and gender in clinical and biomedicine research, public health and education.
So what we try to do in these EUGENMED projects is really to analyze the biological factors that are important for women and men, but also to include the socio-cultural gender dimension that is also very important for health and well-being.
There are different manifestations of acute coronary syndromes in women. For instance, SCADs, sudden coronary artery dissections, which is a tear in a coronary artery, occurs more often in women. For instance, about 10% of all acute coronary syndromes in women below 50 years are sudden coronary dissection.
The implementation of sex and gender into European medicine is still lacking, and this may be due to a gap of information.
But there is a large grey zone between 45 and 65 years where women have a low or intermediate risk, where we need to do better cardiovascular risk assessment, and where problems in the coronary arteries are more functional impairment rather than anatomical obstruction like we see it earlier in a man's life.
You know all here that women and men are different. And when we talk about sex, it's body size, organ function, hormones, enzymes and things. And most of our analysis and what we find is sex differences in this drug bank. We have a few examples of gender. And one example is, for example, anti-obesity drugs. And that is a gender issue, because it's only women, almost only women taking anti-obesity drugs.
Take care that you are being taken seriously for your complaints. So what often happens in cardiology, that the female patient is said, well, it doesn't matter, don't worry about it. But I think you as a patient, you should take your symptoms seriously and demand your cardiologist or other doctor that he or she will listen to you.
Men and women are different in all physical aspects. All bodily systems work differently, which means that in research and in teaching and in managing patients, we have to take sex and gender into account in order to provide better medicine for men and women alike. And the meeting here is dedicated to promote this so very important revolution in modern medicine.
We need to educate both doctors, all other health professionals, but we also need to educate the public. We need to speak using the same language. We need to understand each other. And we also just need to teach future doctors how important gender is. And for this we need courses on gender medicine, but we need also just courses on gender in society, gender and other issues like religion, ethnicity, social economic status. This is a very complex task, but I believe there is a very strong team of people here who want to work on this, and I hope will form a strong group that will continue working. As an organization, AMI is also very happy to discuss the problems of teaching sex and gender and medical education.
Everyone should know that medical students are not trained to be a physician who takes background into account. And that's important because people expect that physicians address their needs. So treatment is more optimal for some people than for others. And it's important that everyone realizes that this is how medical students are trained.
gender issues in medicine are important, have been neglected in the past, and I think that we should include the gender issue in medical education, in clinical practice, and particularly in research. It is important to include more women in clinical trials in order to assess gender differences in treatment and in the response to therapy and safety of drugs.
It is a common endeavor to harmonize higher education in gender medicine in Europe. Therefore, we developed the e-gender knowledge base to improve systematic communication within the gender medicine community and to provide learning materials for future doctors.
Probably not just in medical education, I think in communication generally on sex and gender, there still seems to be confusion. We need a framework for messaging and communication.
We need to encourage interactive education, we need engaging, innovative education material and modules.
I show you one best practice example based on the European curriculum. The development of e-gender learning as one way to realize our project goals. This is how our platform e-gender looks like. You have the opportunity to choose either the German or the English courses. But the majority of you may know this platform already or is familiar with e-learning programs. Therefore, I just show you one slide where I can give you an idea of the framework behind this project. Depending on your prior knowledge and needs, you can choose different learning tools for your education. Moreover, you can choose different sources for information, like the gender revealing or meeting with some experts. And moreover, you have a communication tools platform, which is a widget where you can choose wiki or discussion forums. And moreover, you have the possibility that your learning progress is registered by the workload hours by the system. This is how the concept of blended learning looks like. And that this e-learner platform supports this concept by providing the digital media and the communication tools as complements to the traditional face-to-face teaching. And this is independent of the learning strategy you use. Participants have to verify their knowledge with any kind of examination, otherwise they would not earn any credits. Okay, thank you for your attention.